what will be a 3-part series on prenatal yoga. My name's Bettina and I'm so thrilled to be here with you. It was my intention to actually film these videos whilst pregnant. I'm now 8 months postpartum, as life will turn out sometimes. I didn't quite get there with the videos whilst pregnant, but do know it is very fresh in my mind. I have an 8-month-old baby at the minute. It's my second son. So this practice is designed based on what I did whilst pregnant, but also in my work, working with other women throughout this journey. So we start today with trimester 1. So basically our practice during trimester 1 is really gentle, really restorative. It's about turning inward, which for the most part pregnancy is a journey of that anyway. And really honouring what's going on inside your body. It's not a time for pushing, it's not a time for doing anything new. So trimester 1, we do have the highest risk of something perhaps going wrong. So we really want to just turn in, tune in, and do a really gentle restorative practice. I think prenatal yoga is a really beautiful way to connect with your body and to honour the journey that is motherhood. So it starts from the very first moment of conception, and from then you are changed, and you change throughout the whole 9 months, and then that beautiful moment of birth where you are born as a mother. So I think this practice, we can really tune into that energy and really honour the journey towards motherhood. So let's get going. I hope you enjoy this practice, trimester 1, turning in. Namaste. So let's remove the bolster now from underneath our bottom, and we'll come to lie down on our back. So the choice is yours at this stage. You can still quite safely lay on your back at this stage of pregnancy, but if you'd like the support, you can add a bolster, cushions, anything you like, just to elevate that torso a little bit more. Now again, you can also quite safely lie down, still activating those core muscles at this stage, but to get into good practice, you may want to start working with the hands, just to allow yourself to gently lay down without needing to use too much core strength to get there. So let's just take the arms wide, bring the soles of the feet together. Letting the knees fall out to the side. If they're not comfortable resting down, you may want to put cushions underneath them to support that little bit more. Just breathing deeply into that lower belly, being forever present to the growing life that exists there. And with each inhale, feeling the air circulating through the body, and in particular in this area, bringing beautiful fresh oxygen and blood to our baby. Stay connected to your Ujjayi breath, hearing your own exhalation. As you inhale, draw the knees together. You can use the hands to support. Now either leaving the bolster there if it's comfortable, or you can remove it at this stage. For trimester 1, it's still fairly safe to lie on the back, because we don't have a huge amount of extra weight yet. And just take the feet wider than the mat. And as you exhale, gently let them fall to the side. So if it feels good, you could take the arms wide, feeling into this beautiful stretch from hip to armpit. Maybe even looking away from side to side, drawing those shoulder blades down into the earth and feeling how that feels through the upper back. And as you exhale, draw the knees back through center. Let them fall to the opposite side. Again, draw down through shoulder blade, letting the head and neck completely release. And then inhale all the way to the other side. And then wipe them back, exhale to the other side. So just doing gentle movements, warming up through those hips. And then drawing the knees into the chest. So starting already to practice with knees wide. It's not so obvious and necessary at this stage because we don't have the big belly yet. but it can be a good habit to get into. And also this area, if it's feeling bloated, you won't enjoy drawing those knees right in. So keep it wide. It's also helping to open up through those hips a little bit more, which is obviously something we want to take advantage of. So just gentle rocks from side to side. And then moving into our happy baby. So either holding onto the calves and drawing the knees down, or if you can reach, taking the hands to the soles of the feet and exhaling those knees down towards the floor. Again, taking small movements from side to side may feel good for you. If it doesn't, you can hold still. And stay connected to that breath. As you exhale, release the feet. Draw those knees back down once more. Let's bring the soles of the feet together. So you may find your knees are quite high in this. If so, just grab a cushion, place them underneath each knee. So really work at supporting. Again, we don't want to put too much strain on this inner thighs. The body's already releasing and relaxing. If you are comfortable, you can just work with the knees resting down. So again, think of that pelvic tilt. So you don't want to be too rounded. That's going to put pressure on. You want to sit tall, tilting that pelvis forwards. Again, if you need to, bolster under the hips. Under the tailbone rather, we'll tilt those hips forward. So just hold onto the feet. We're going to do a bit of a cat-cow here with the upper back to really stretch out what can get quite tight as a result of the lower back tightening. So as you inhale, open up the chest, lift the head. And as you exhale, round through the spine. This is where that rounding action comes in. Inhale, lift. Exhale, round. Inhale, lift. Exhale, round. Once more, inhale. And exhale. And then find that natural tilt once more, so upright spine, tilted pelvis. And if it feels good, you could creep the hands slightly forward, just increasing that stretch through the inner thigh and groin just a little bit more. So take it easy. There's no need for pushing. So sitting up tall again, drawing toes back towards you, leg is active as it presses into the floor. Inhale, rise the arms. And exhale, fold forwards. So if you're feeling a little bit bloated in this area, staying tall through the chest and just feeling that tip from the hips will be enough. You won't need to come low, even if you do have quite a lot of flexibility, because you won't want to be compressing this area. Our body naturally wants to protect, and you probably notice pants and anything that sits tight on that area now is not feeling comfortable for you. That's your natural instinct telling you to everything off. It needs to be easy, free, and flowing. And if you can connect into that feeling now and really honour what feels good now, you'll be ahead of the rest of us in this game. So keep breathing through that chest, breathing deeply into that lower belly, and just ever so slightly tipping from those hips. And then as you inhale, we're going to take a gentle twist, and you've probably heard twists are no-nos during pregnancy, but open twists are fine. So as long as there's lots of space and air around this midsection. Let's just take the hand behind, press it into the floor, and take the other one to the knee and gently press, opening through the chest. So the spine is gently twisting. If at any stage this isn't feeling good, of course, feel free to stop. And then exhale, slowly coming back to the front. Bringing the other foot in, changing sides. So again, activating these muscles, drawing the toes back. Inhaling, arms up. Exhaling to fold. Feel that chest lifting. And with each exhalation, see if you can just relax into it a little bit more. So not pushing into it, just noticing the muscles that are tight. See if you can relax them. One of my favourite things about yoga and the practice of yoga during pregnancy is that it really does teach us everything we need to know for birth, for those last uncomfortable few weeks before baby arrives. And it really is just about learning to surrender and let go, to become comfortable with what's going on, to be able to sit within discomfort. As you inhale, slowly sit. Take the hand behind, sitting tall, pressing into the leg, looking over that back shoulder. And slowly release back to the front. Removing the bolster if you've been using one. Coming into a reverse tabletop. So bringing the hands underneath the shoulders behind you, fingers pointing towards the toes. Bring the feet in and bring them a little bit wider than hip distance. So you want a little bit of extra support. Not too close, because as you exhale, you're going to press into the feet, lift the hips up. So this might feel quite strong through the shoulders. So keep lifting those hips, standing strongly into the feet. And just breathing. If this doesn't feel good, of course, gently give it a rest and come to lie down on the backs. We'll be there shortly. And then exhale, slowly bringing the bottom back down, stretching the legs out, using the hands to support, coming all the way down onto the back. And let's once again take the right hand to heart, left hand to belly. Breathing deeply into that lower belly and feeling connected to the life within. Feeling the heart beating beneath our right hand. And imagining the heart beating beneath our left. Imagine and visualize the connection between the two hearts. So I'd like to thank you so much for joining me today. I hope that this video gets you started on your journey towards a practice of yoga throughout your pregnancy and hopefully beyond as well. It really is a practice that will support you throughout all 3 trimesters. As you'll see, each video changes quite significantly. Here we started with quite restorative, honouring what's going on inside. In the next trimester, we do build a fair bit of energy. You will find your energy starts returning. Yay! And then in video 3, we slow it down once more. It's more about feeling into the body, getting into positions, preparing for birth, and working on some breath work that will hopefully guide you through labour and beyond. So I hope that you enjoyed everything that we've done today. I recommend, if you can, finding yourself a yoga community, whether that be online, whether that be reaching out to a teacher that you know of. I'm always available if you want to shoot me an email. Or if you do have a local studio, finding a prenatal yoga class and a teacher that you can work with. The community that you can build in these classes really is invaluable, especially as it means you'll probably find some other women who are at the same or similar stage to you, and therefore you'll have children at the same time together. So I'd like to thank you again from the bottom of my heart for joining me, and hopefully you'll join us again for video 2.